Let me ask you a question, folks. Do you suffer from headaches, neck, ear, or facial pain? Does your jaw click sometimes when you're opening and closing it? This could be TMJ. It's a painful condition, but there is help if you know where to look. And we found it. Please welcome Dr. Dwayne Keller from Keller Professional Group. How are you, sir?
Doing great. Good to see you.
Nice to see you, too. Welcome back. I feel like TMJ has become, for a lot of people, an umbrella term that can describe a lot of different symptoms. So boil it down for us. What really is TMJ?
Well, you're right. TMJ is sort of a catch-all, but it's basically the initials of the jaw joint, temporomandibular joint, and sort of it's a category that any type of headaches, facial pain, etc. We in dentistry, we in medicine sort of stuffed it in that category as something that we can begin to say there's the niche of the problem.
So what's happening that's causing pain?
Well, pain usually comes mostly either from a misalignment. Really what you should have is when you bite your teeth together, the joints, the muscles, the head, the neck, they should all basically work in harmony. When something becomes compromised, if it's the joint, usually it makes noise, clicks or pops. If it's the muscles, you usually end up having pain in your temporal or the back of your head or something like that, or the facial muscles themselves. If it's the teeth can become loose, they can wear, and they just don't seem to fit together the way that they're designed or supposed to.
I was a little surprised to find that there is no real specialty in the field of dentistry for this. So I bet there's a lot of people out there dealing with this who are frustrated because maybe they've been bounced around, they've seen their MD, they've seen their dentist. What are you supposed to do if you're facing symptoms like this?
Well, I think that what the person should do is check with their physician first.
Okay.
Let's be sure there are no life-threatening entities that are a problem. And then if you're suffering with, well, I think the easiest way for people to understand that they may want to then check with their dentist after their physician. If there's noise in the joint's not supposed to be noisy. Should be noiseless. But if you get a clicking or popping, it usually means that the cartilage inside the joint is slipping a little bit. Or if you end up with headaches, either in the temporal region, facial region, or actually even the back of the head, because those muscles have to counteract your jaw movements. So I think those are the easy ways, and you should have a normal range of motion. You should be able to open your mouth wide enough to get 3 fingers in vertically between your front teeth.
Okay, 3 fingers in. I want to test right now, but I feel weird doing that on TV.
I didn't do it, so I'm leaving it up to you.
But I literally, when you said that, I went like this and thought, I think I could probably do that. So for people watching right now who may be dealing with this, what do they really, really need to know about TMJ, and what's the next step for them?
I think the first thing, or the next step for most people, is to get some professional assistance and see if you have the problem. Because if you can catch it early enough, well, it's like anything else. The earlier you catch it, the easier it is to treat it.
Right, sure. He's very modest. He's not going to tell you this, so I will. People come from way out of state, from across the country, to come see this guy for relief to something that no one else has been able to diagnose properly. He's not going to say that, but I will. Thank you, Dr. Keller. We appreciate it.
Well,
if you are experiencing these problems, discuss them with your dentist or call Dr. Keller at 314-638-4190. He'll help you find out why you have pain and maybe more importantly, what you can do about it. Or you can always check his website. It's drdwaynekeller.com to learn more about this TMJ. Kent?
I know a lot of people have had pain in other places that they didn't realize it was a jaw misalignment, and it's a life-changing surgery for those people.